to stretch to say goodbye to lower back pain. Four major muscles to stretch to say goodbye to lower back pain. Our current digital age has taken control and overcome our lifestyle. Modern way of being sedentary still creeps up in our daily life, particularly the very typical sitting position. Right now I'm sitting. A likeness of the most comfortable sleep position in a half upright form or an upright fetal position. Likeness or not, the specific muscles that degenerate as we get older is so much affected in a sitting position. It is affected in such a way that significant neurological control is less likely being reinforced, and it ceases to be stimulated to keep it at least at its level of health. This is no other than the postural muscle. Postural muscles are muscles that defy gravity and therefore keep us upright, young, and can even make you look smarter. These are the first muscles to age and gets weak as we get older. Today, we will be discussing about the four major and most important muscles that will give the postural muscles to optimize its role on keeping us from being pulled forward in our daily life, leading us to slouch and worse, a lower back pain. Functionality check for each muscle to know if you are short on your ideal range of motion will be included in our topic for today as well. As part of your self-assessment and goal, and as a guide to know if you are progressing. Just a reminder that all muscles mentioned or will be described here exist in pairs, a right and left side of the body. The more physically active you are, the more you need to be balanced for your right and left to perform at its peak level and lower your chances of premature injury. The following muscle will be in order, starting from the easiest to stretch, but all of them are important in promoting and optimizing your functional mobility. For our first muscle is gluteus complex. Here, the strongest muscle of the lower body is included. This fan-shaped muscle is named after the movie hero in Gladiator, and that is gluteus maximus. This muscle needs to be stretched, but usually very easy to overcome and progress compared to other three muscles that will be mentioned later. Easier to stretch since strength is actually more common to be the problem. Hip and lower back pain can offset the biomechanics function of the glutes that can lead to motor dysfunction with concomitant atrophy, meaning buttocks can go soggy and flat, very common with serious chronic lower back pain. Hip rotator muscle is another stretch manageable area that is common to be weak like the glutes. If the hip rotator is below its ideal range of motion, not only can damage your lower back, but also can ruin your knee joint. Hip rotator is very important when you rotate or turn to your right or left. The stressful and forceful torque can be produced the more faster you move. One-sided sports is a good example, like the common tennis or golf, usually have only one-sided flexibility turn of the hip rotator as a result of the sport's preference and motion requirements. Crossing over your leg on the opposite knee while seated can be used as a functionality check. I'd rather be checking more on your ability and comfort to cross the leg than check on the bilateral range of motion similarity. At least a hip rotation of more than 45 degrees on both sides. The more you can bring your lower leg parallel to the ground, the better. While doing this, make sure that your upper body is in proper form and posture to be more accurate to your assessment. An indirect functionality check can be done by how much rotation you can do with your hip while standing. Your foot will be your flexibility reference. This standing position may not be that accurate since your ankle and knee joint is participating beside the hip joint, which is the one we are concerned with, but can be used as an option if crossing your leg is impossible. Number 2 is the quadratus lumborum, commonly known as QL to most people. This is attached to your lowest rib and to your hip bone, a short muscle that can pull down the shoulder and pull up the same side of your hip during a serious low back pain flare-up. Holding up this muscle due to lower back stiffness will make you walk like a wooden toy soldier. You will lose your hip rotation, which happens as your shoulder rotates to the opposite direction. This is a natural hip-shoulder contralateral motion that will make your movement efficient and smooth. Even the articulation, bounce, or the natural shock absorption will go into malfunction, and it will greatly reduce your own protective ability from repeated vibration and force brought about by your daily hip movement. This muscle located the deepest among the four major muscles, which makes it difficult to stretch and lengthen, especially in self-stretch approach. Since QL is a deep muscle, we are looking for a smooth curve of your right and left side in this functionality check photo, and should be similar with each other if possible. Left side is usually shorter with the right-handed people who have chronic back pain. Right side will be more sensitive due to overworking on pulling your body to each side. Now the third muscle, the latissimus dorsi muscle, or commonly known as lats, where lat pull-down exercise got its name. Bodybuilders accentuate this wide back muscle to create this infamous V-shaped upper body muscles. In combination with the upper backbone and other muscle, this is responsible for bringing your shoulder in front to be known as a rounded shoulder. Beside its strong influence to the slouching posture, it is attached all the way to the middle of your hip. If you see your reflection in a mirror and notice that you put part of your whole hand on your thigh when you stand, the lat muscle is most probably is responsible. Hand ideally should be at your side, palm facing your side. In front, only two fingers should be seen, namely the thumb and your index finger. In addition with your postural habits, bringing your hand further in front of your body means weight is repeatedly distributed forward. This will negatively reinforce your poor posture by bringing the rest of your body forward and downward. So what is the best way to check the length of your lats? Lie on your back while keeping your lower back in neutral curve. Raise your straight arms up overhead. Ideally, your arms should be straight, resting above your head with your lower back still in neutral position. Neutral position means it does not compensate or move up while your arm is above you. The relationship action of short lats muscle with overarching of the lower back makes this functionality check important to use as a benchmark in the process of relieving your back pain. And lastly, the iliopsoas muscle. Two muscles attached on the same insertion. For now, we are more concerned about the psoas muscle that attach itself at the front side of the 5 lumbar spine or backbone, which makes it easy to pull forward an unstable lower back. Psoas muscle is always short and inflexible when you have a chronic low back pain. Usually one side is shorter than the other. And usually a serious recurring low back pain can shorten this muscle in its reverse range of motion. A good example, a negative 10 to 15 degree of hip range of motion is common instead of the ideal 15 degree of hip extension or the hip moving backward. Just imagine your thigh is stuck in the front groin area. To compensate for this usual position, it will be pull and increase the lower back curve, thereby increasing the compression and stress to the lower back. Psoas muscle is notorious to be very difficult to stretch once you have a poor range of motion. There is two ways you can check your flexibility. The first one is the easiest and practical. Since most people are tight on their psoas muscle, the standing functionality check will be suffice. Remember that it will pull your spine forward. Therefore, to be accurate, engage your abdominals before going to its full position or full range of motion. In short, don't cheat by arching your back. If you are more active, the next functionality check photo is recommended to re-establish a better and balanced curve of your lower back. This should be your goal if you are a more or less overachiever or doing more than average activity. This will also reset the length tension relationship with other muscles and restore better biomechanics and physical performance. For listening, this is Jace Lee. I am an active, isolated stretch practitioner.